I'm Linda Elsiegood, founder of the LDN Research Trust. It has been my honour to interview LDN researchers, prescribers, pharmacists and patients from around the world for many conditions. Thank you for joining us. This evening I'm joined by Dr. Richard Nahas from the Seekers Centre in Ottawa, Canada. Thank you for joining me, Richard.
Thanks for having me.
As I was saying, I think we spoke about 5 years ago. Could you tell us what's been happening since we last spoke in the world of LDN?
Well, when we last spoke, my practice was a general practice, and I was treating cancer and autoimmune disease and chronic inflammatory disorders and allergies, all of the myriad disturbances of the immune system that LDN has been used for. But over the past 3 or 4 years, we've restricted our practice to brain-focused disorders. So we treat chronic pain, and we treat post-concussion syndrome and post-traumatic stress that are sometimes associated with pain after injury. Mm-hmm. And the use of LDN that we have found most important to focus on with our patients is not necessarily limited to one specific symptom, but rather to address the inflammation in the brain that can be causing a wide range of symptoms. So in some of our patients, there are improvements in mood. In others, there are improvements in sleep or energy. Some experience decreases in pain. Sometimes memory and concentration improve. And, of course, there are the associated improvements that are sometimes seen with digestion and skin, etc., that are related to the immune system. But this is in keeping with recent evidence, in vitro evidence, that Naltrexone can turn down the thermostat, if you will, that sets the temperature for inflammation in the brain. And so the cells called microglia, which are responsible for maintaining the health of the brain, can be overactive under situations of chronic stress. And that overactive microglial environment triggers chronic inflammation in the brain, which is basically what ages the brain. It's one of the most important mechanisms of aging of the brain. So while one of our goals is symptom management in these patients, we know that if you're not sleeping, if you're in pain, if you're depressed, if you're struggling with brain fog or any other brain-related symptoms, chances are that there's some degree of inflammation in your brain, and that means that your brain is aging faster than the rest of us. And there have been some long-term studies looking at incidence of dementia with people who have these disorders, but it's often difficult to tease out what is causing it. They have many reasons to be at increased risk for aging of the brain. But whatever the reason, my rationale for prescribing it is that this is going to protect your brain in the long term. So usually we're actually finding that an initial starting dose of 3 milligrams is less prone to causing difficult insomnia. So we start with that dose. And we typically will manage the sort of mild short-term sleep disturbance or the increase in pain that people might feel for the first few days with melatonin or passion flower or valerian, some other gentle, natural sleep aid. And we tell them that if they're feeling worse, it is actually a sign that the LDN is working.
Mm.
And that often makes it easier for them to tolerate that initial period. And then usually after 2 weeks, we can increase the dose to the standard 4.5 milligram dose. And we typically say that within one prescription, and our prescription is about 60 days, within one prescription we'll know whether or not this is going to be helpful. And because of some other in vitro evidence that suggests that there's a kind of a new activation of the opioid, the endogenous opioid system, if you take a break from LDN, we take a pause of about 7 days in between prescriptions. And patients actually are reminded of how bad their pain was before they went on LDN, because they do get a little bit worse in that 7-day period. And if it's too uncomfortable, we tell them they can forego the 7-day period. But we rationalize this to them as a way to kickstart the endorphin system one more time. And we recommend that they stay on it for at least a year. And in many cases, they're happy to stay on it long term. Because as long as they've got ongoing symptoms that are triggering brain inflammation, it's helpful to have something to counteract that.
You mentioned dementia there. Have you had any experience long term with using LDN for like dementia?
I have not. We have been focused on this population who are at risk for dementia.
Okay.
And we see them shortly after their injury. And when I say shortly, I mean in some cases a week after their injury, in other cases 2 years after their injury. But we don't have our own results from people who have been on LDN for 5 years post-injury to compare them with people who have not. The problem with collecting this data, as you probably know, is in a multidisciplinary approach that we take in the integrative medicine setting. We're mixing and matching a number of different medicines in every patient, and sometimes LDN is part of the mix, and when it can't be part of the mix, then we rely on other resources. So it's hard to say that LDN is better than our other tools, but definitely for those who get benefit from it, it's an important one.
Food for thought.
Well, I think it's very contrary to the modern medical paradigm, which is based on a diagnosis in terms of what we're treating. It's contrary to find a medicine that treats so many different things. And that raises skepticism among some. This is promoted as a panacea. It can't possibly work for so many things, et cetera, et cetera. But what we're seeing now in the integrative physiology paradigm, which is actually being adopted across the world. We're understanding that the gut and the immune system and the brain and the hormone system are all working together, and that they can affect multiple organs in multiple ways. So rather than saying that this medicine treats this disease, we recognize that this medicine treats a process which can be part of hundreds of diseases. So rather than prescribing LDN for a specific condition, my approach is if a person is suffering from chronic illness for any reason, that person should undergo a therapeutic trial of LDN.
Yes.
Because we don't know whether it's affecting the endorphin system or not until we try it.
And side effects, what were you
saying before we started the recorder about side effects?
Well, there are patients who experience really unusual symptoms when they start LDN. Of course, if you're using an opioid or if you've very recently discontinued an opioid, then that's another story. But very often we've seen patients who have strange, unexpected, unusual side effects. And we assume in those cases that there's some sensitivity or low-grade allergy to the naltrexone or to some aspect of the endogenous opioid system, the endorphin system. And so I will either do something in the office myself or I will refer patients to a vibrational medicine practitioner who uses NAET or some similar technique for turning off sensitivities. These approaches are sometimes called holistic desensitization techniques. And when we can find and treat sensitivity to endorphins or to naltrexone, all of the side effects disappear and people can continue using the medication and in many cases benefit from it.
That's interesting. That's the first time I've heard that. I'll have to look into that further.
Well, it's something that has been very much a departure for me in my integrative medicine practice, because when I started 10 years ago, I was very much focused on functional biochemistry, and I limited the scope of my practice to things that made sense within the medical paradigm. You know, vitamins, plants, supplements, manual therapies, things that I could wrap my head around. But it wasn't until I started seeing very significant responses to some of these techniques that you might consider falling under the umbrella of energy medicine, that I began investigating its rationale and have started to understand how all of these disparate therapies, including homeopathy and myofascial release and acupuncture meridians and energy therapy and Reiki, how all of these things can actually be explained in terms of modern physiology, and how in many cases when the immune system goes awry, it's because of a disturbance in the nervous system. And these disturbances in the nervous system can sometimes be treated using the tools of vibrational medicine, in addition to tools like LDN that target the nervous system.
And is there anybody in Ottawa that would like to come and see you? How do they get hold of you?
Well, we're actually now more focused on delivering brief, intensive treatment. And so some of our patients do come from Ottawa, but more are coming from further afield. Our website is www.seekerscenter.com.
Well, maybe I will interview you again in another 5 years' time.
Well, my door is open. As long as we're talking about healing, we're on the same page.
Well, thank you very much for your time today.
All the best.
Do you have LDN experience to share? If so, please email me, linda@ldnrt.org. I look forward to hearing from you.